Hey everybody, welcome to today's lesson on Doppler ultrasound. This lesson focuses on Doppler shift and the effects of the angle of insonation in Doppler ultrasound. Doppler ultrasound is a critical imaging technique used in diagnostic medical sonography to evaluate blood flow and tissue motion. It allows clinicians to assess hemodynamics, detect vascular abnormalities, and diagnose conditions such as stenosis, occlusions, and deep vein thrombosis. The fundamental concept behind Doppler ultrasound is the Doppler shift, which occurs due to the movement of a sound wave relative to a moving target, such as red blood cells. The Doppler shift is the change in frequency of the ultrasound wave due to motion of the sound source or the reflector. This shift occurs when the transmitted sound wave interacts with a moving structure, in this case moving red blood cells, causing an increase in frequency when the reflector moves toward the transducer and a decrease when it moves away. Think about when you're standing at a street corner and you hear a motorcycle approaching. As the motorcycle approaches, the engine sounds increase. As the motorcycle drives away, the engine sounds decrease. The increase and decrease of the engine sounds is caused by the Doppler shift. The Doppler shift can be mathematically expressed using the Doppler equation. It's unlikely that you'll be asked to compute using this equation, but understanding the variables is important, where f sub d is the Doppler shift measured in hertz. F sub t is the transmitted frequency from the transducer measured in hertz. V is the velocity of the moving target, in this case red blood cells, measured in centimeters per second. Cosine theta, where theta is the angle of incidence between the ultrasound beam and flow direction, measured in degrees. In other words, theta represents the angle at which the ultrasound beam hits the blood flowing in a certain direction. C is the speed of sound in tissue, usually estimated to be about 154,000 centimeters per second. The 2 lets us know that there are actually 2 Doppler shifts that occur during an ultrasound exam. The first happens when the incident sound wave from the transducer strikes the moving red blood cells. The second happens when the resulting echo from the red blood cells travels back to and strikes the transducer. Let's take a closer look at the angle of incidence and velocity. The accuracy of Doppler measurements depends significantly on the angle of incidence, also called the angle of insonation. If we were able to place the transducer inside of a blood vessel with red blood cells moving either directly towards or directly away from the transducer, we would be able to measure the velocity of those red blood cells with 100% accuracy. However, due to the nature of the human body, we have to place the transducer at an angle to the blood vessel. This angle causes our measurement to be less than the true velocity. Fortunately, we can use the cosine of the angle to determine the true velocity. Let's take a look at this table. Again, notice if our angle is 0, then our cosine is 1. This means we're measuring 100% of the blood cell's true velocity. As we increase our angle, we're measuring less and less of the blood cell's true velocity. At 30 degrees, we're measuring 80% of the velocity. At 45 degrees, we're measuring 70% of the velocity, and so on. When we get to 90 degrees, we cannot measure the blood cell's velocity because the cosine is 0. Therefore, we get no Doppler shift. So, for example, if we're performing an exam with a 60-degree angle of incidence and get a measurement of velocity of 50 centimeters per second, we know, based on this table, that the actual velocity is 100 centimeters per second. This is because at 60 degrees, we're measuring 50% of the actual velocity. We typically use angles between 30 and 60 degrees for Doppler ultrasound procedures. This is because when we set our angle of incidence on the ultrasound system, we will never be completely accurate. We may be off by a few degrees above or below our setting. As our angle increases, these errors of a few degrees change our measurements significantly. Let's look back at our earlier example. Let's imagine we know that the actual velocity is 100 centimeters per second at a 0-degree angle. If we had an error of 3 degrees, the estimated velocity would be 100.1 centimeters per second. Not too far off. If we set our angle of incidence at 45 degrees but had a 3-degree error, the estimated velocity would be 105.7 centimeters per second. Still not bad. However, if we set our angle of incidence at 80 degrees and had a 3-degree error, the estimated velocity would be 145.2 centimeters per second. That's an almost 50% increase in velocity, which is a significant error. As our angle of incidence increases, the estimated velocity increases exponentially, just due to how cosine functions behave mathematically. So it's typically best to stay within 30 to 60 degrees, as the natural human errors are less impactful to the measurement. It's important to note that extreme velocities, such as those in stenotic regions, may cause aliasing in pulsed wave Doppler, requiring adjustments in pulse repetition frequency. This is discussed more in different lessons. Let's try a practice question to check your understanding. Which factor has the greatest impact on the accuracy of Doppler shift calculations in clinical ultrasound? A. The transmitted frequency of the ultrasound wave. B. The velocity of the moving target. C. The angle of incidence. D. The speed of sound in tissue. Take a second to figure it out on your own. The correct answer is C. The angle of incidence. The angle of incidence directly affects the Doppler shift calculation because the cosine function influences the measured velocity. Errors increase significantly as the angle increases above 60 degrees, making angle correction essential for accurate velocity estimation. In summary, the fundamental concept behind Doppler ultrasound is the Doppler shift, which is the change in frequency of the ultrasound wave due to motion of the sound source or the reflector. The Doppler shift can be mathematically expressed using the Doppler equation. The accuracy of Doppler measurements depends significantly on the angle of incidence, also called the angle of insonation. As our angle of incidence increases, the estimated velocity increases exponentially due to how cosine functions behave mathematically. Therefore, it is recommended to stay within 30 to 60 degrees.